Hi, everybody. This is Rhonda Cobb, the Money Coach. I am so glad to be here and to be able to bring you this important topic. It's so timely and everybody's talking about it. So let's just weigh in a little bit. Let's talk about this. You know, if you're a regular listener, and we're so glad that you are, because if we didn't have regular listeners, there would be no point in having a show now, would there? But we've been doing some stuff about medical bills and medical billing and medical pricing lately, right? So this time around, we're going to talk about something that's very popular at the moment. And I'm sure you've heard of this idea unless you have no access whatsoever to the internet, the TV, or social media, in which case I'm not sure how you listen to the show. And that is Medicare for all. And what I want to know is, are we really ready for this? And why are we going to have this discussion today? Because, I'm not always very political whatsoever. And here's the reason because so many people have medical debt and it's so difficult for them. And because health insurance is so expensive that a lot of people still don't have it because they can't afford the premiums. Or they have insurance, but they cannot afford the deductibles and the copays, so they do not go and get the care that they need because they still don't have what's called the OOP. OOP stands for out of pocket. So if you're somebody saying, oh, well, your out of pocket is, that's the part that you're going to pay. And a lot of people don't have it. So, and the last reason we're going to go through this discussion today is because a lot of candidates and some of our incumbents believe that a bigger government presence in your life is a good thing. Well, I'm going to let you figure that one out on your own. I'm not going to tell you how to think. Cool, right? Usually I solve the problem. Today we're going to discuss the problem. By the end of this, I want you to feel like you are more prepared to make a decision, more informed, more facts, more figures. Yes, that's right. Think for yourself. I know I'm such a radical. I'm not going to tell you what to think. Oh, so cool. So onward. I am trying to keep this non-political, but with so much of this out in the political arena, um, it might be a little bit difficult to completely and totally segregate it, but I'm going to do my best. And remember what I said when we talked about surprise medical bills. This is the second crisis in healthcare management. And yes, it's still a crisis in management. Remember what I said? The crisis of not caring, the crisis of greed, and the crisis of passing the burden of their responsibility onto the consumer, and the crisis of simply not thinking in a logical pattern. And sometimes they tell me I don't understand, and I'm okay with them saying that because that's not true, and I know it's not true. What the problem is I understand all too well. They just don't want somebody who's real straightforward and factual thinking to weigh in because it can confuses their garbage that they're putting out. But I want to read you this quote, and this is not my quote. This was on a public forum on LinkedIn, and I want to credit this person for her research and her words. And her name is Marsha Friedman. She's a consultant. And I'm going to quote this. All right. She says, as long as healthcare is financed by quote unquote someone else, it is unlikely to change. According to Kenneth Thorpe of Emory University, under Medicare for All, 71% of households and 85% of Medicaid recipients would end up paying more and be worse off. Supply will not meet demand. Think of it as a buffet. And it will increase cost about 16% based on figures from the Urban Institute, which is conservative. Rationing would be the narrative, In Canada, specialty care is hard to find, with some patients waiting 10 months for orthopedic procedures, and out of a population of 30 million, 1 million wait 5 months to be seen for other illnesses. Physician pay will drop dramatically, and there would be an economic shock as well. Medicare and Medicaid fraud, estimated at $80 billion today, would rise to 200 to 300 billion a year under a single payer. I suspect Florida will still lead the way in that arena. Estimated job losses will be 1.5 million on the hospital and physician side, and millions more potential job losses in allied fields. Medicare will exist no more, as the Sanders bill in Section 901 abolishes Title 18, which would toss 20 million seniors. And no doubt, Medicare trust funds would be rated to fund coverage for all. And again, that was a quote from a consultant on LinkedIn. But let's, for us, review what we know about Medicare. Now, as a licensed health insurance agent, I did take and pass with above a 90 the required classes to become certified to sell Medicare supplements and Advantage plans. So I can say with some degree of authority that I do know a little bit about Medicare and how it works. But I do not, let me make that clear, do not speak for any particular company, carrier, nor Medicare themselves during this show. I am not a government agent, and I am not speaking as a contracted agent of any specific company that sponsors any specific Medicare plan. All right, but now let's go on with our discussion. The first advertised plus with Medicare is that it covers everything for free. That's what the politicos want you to believe. However, the fact is that Medicare does not cover everything, and standard Medicare does not have a maximum OOP. What was OOP? Out of pocket, in terms of the copays required. So keep that in mind. The next advertised plus is that Medicare seems to be taken everywhere. Again, the fact is that Medicare is not accepted everywhere in the United States, and it is not accepted anywhere outside of the United States. The next advertised plus is that Medicare covers every senior citizen and disabled citizen. And again, the fact is that Medicare only covers those citizens who paid into the program while employed for at least 40 quarters, and those who have been on Social Security disability for over 24 months, unless they have a catastrophic diagnosis like Lou Gehrig's or end-stage renal disease, and then they get coverage as soon as they're diagnosed. Okay, so you see where we're going, right? But we're not there yet. Let's continue on our journey. The next advertised plus is that Medicare is free. Again, the fact is Medicare is not free. Part A is free if you had your 40 minimum quarters of employment that paid into the program. But Part B is over $125 per month. The next advertised plus is that Medicare is a single payer system. Again, the fact is that Medicare is an extremely complex situation with many plan sponsors, also known as insurance companies, and nearly every health insurance company is involved or offers some type of Medicare supplement, Advantage plan, or prescription coverage plan as a plan sponsor. And while each plan must be presented to CMS, which is the Centers for Medicare Services, for approval, and competition is not totally encouraged, but compliance is a huge, gigantic word. All right. The next advertised plus is that this will solve all of your medical care problems. Again, the fact is that Medicare recipients still have out of pocket expenditures, a lot of them in the thousands per year. They can still be the victim of surprise medical bills, especially with emergency visits, and they can be denied needed treatment if the plan sponsor or CMS themselves deems it to be not medically necessary. Now, ask anyone 70 years old or older, someone that's been in Medicare for a few years, if this is indeed the case. And oh, yes, by the way, Medicare alone does not cover dental, vision, or hearing. Now, some of the Advantage plans do, but standard Medicare does not. The next advertised plus is that Medicare will pay for your insulin and other prescriptions. Again, the fact is that Medicare only pays for part of these expenses, and a Part D plan, also known as a prescription drug plan or PDP, is a premium based out of pocket add-on that helps to offset prescription expenditures. But there are, make no mistake about it, out of pocket prescription expenditures for many, many, many people on Medicare. Now, you're starting to think, what? Hold the phone. That's not what I heard on TV. That's not what I saw on Facebook. But, exactly. So, why do the candidates espouse these advertised pluses? Hmm, I don't speak for them, and I'm trying not to be political, but is it possible they want your vote? They don't need to educate you, they just want your vote? Is that possible? I'm not answering that. I'm asking you. I hear you. A lot of you are answering it right out loud. Now, let's talk about how you can decide what you want to do or choose. And I'm going to ask questions designed to help you. This is where you might want to pen a paper and a pencil so you can jot notes, or maybe you want to do further research or whatever. All right? So let's go. Who would benefit from a Medicare for all senior scenario? And who would be hindered by a Medicare for all scenario? Does it sound like it will be the way it is being advertised based on what we just told you about the advertised pluses and the effects? Does it sound like it will be the way you envisioned it? Who's going to pay for it? This is the big one. Are you willing to take a 20% pay cut to fund it? You're already paying into Medicare with what your employer pays and what your payroll tax deductions are, but no matter how you look at it, that would have to increase. So are you willing to see that happen? Are you willing to give the medical industry free reign over your healthcare choices? Why do you want an expensive program that limits your choices of providers, services, and medications? Do you want forced health care